So you are ready? A very good morning to every one of you, and thank you so much for allowing us to have this kind of conversation this morning regarding the state of our nation, and especially matters to do with the newborn babies, infants, and lactating mothers of this country. My name is Gathoni Wamuchomba, a member of parliament for Githunguri constituency, elected to the parliament, and I have been consistent on matters maternity care, respectful and dignified maternity care, and I have a few concerns that as a mother, as a leader, makes me feel that I should address to the issues. Fellow Kenyans, our country continues to face very serious and worsening challenges under the current administration. There is an education crisis in this country. Our education is being disrupted because government capitation funds are not reaching schools on time. We are disrupting life of our children. It is deeply concerning that while funds are allocated for renovating State House, such as 2.3 billion allocated for this financial year's budget, money is being promptly provided for renovation of State House, but essential education funding is getting delayed, and this is totally unacceptable. Care systems breakdown, the health sector is equally under siege. Over 8,500 workers, healthcare providers are currently on strike. Just yesterday, we witnessed a very dehumanizing case in the Regania Hospital in Githunguri, North of Kiambu County, where a father was mourning the loss of an infant in his hands, allegedly because there was no healthcare providers and doctors to attend to the very needy infant who eventually succumbed. It is very that those very many incidences are happening not only in Kiambu County, but in all counties in this country, because health crisis has been devolved. It is unfortunate that we are not devolving market constructions where money is. We are holding tightly on constructions of market as national government, but when we are not able to sort out the health crisis in this country, we devolved problems to the counties. I am not here to defend county governors and administrators, but I am here to highlight that there is a serious problem in our health sector. We can't assume that life is okay and it's normal to continue with life when over 8,500 health care workers are on strike. Critical vaccines such as BCG and polio are in short supply across public hospitals. Parents of newborns are now being forced to turn to private facilities where polio vaccines cost between 10,000 and 15,000, amount many cannot afford to pay. We have misplaced priorities and political gimmicks. Instead of addressing this very urgent crisis, the Deputy President and several Mount Kenya and MPs of their National Assembly, and this has largely been concentrated in Mount Kenya, but it has been seen in other countries like Kisii, MPs are busy holding political rallies in the name of economic empowerment forums. And they continue to distribute handouts across the region. Yet, babies born in those areas where these handouts are being distributed cannot afford BCG and polio vaccines. It's very unfortunate. Meanwhile, President Ruto continues to expand his advisory team. Now he retains over 20 advisors who continue to consume more than 1 billion shillings of public funds annually. Yet we cannot afford to bail out our newborns. We cannot afford to acquire BCG and polio, yet we can afford to maintain these advisors at this alarming level. It is my hope that as I speak now, we are going to remit money that is held up by HELB for our university students. Thousands of university student learners are continuously being chased out of university classrooms and lecture rooms. They cannot access to sit for their exams, basically because they have not been able to pay their HELB portion of HELB contribution. Most of the parents are complaining that they have already paid their household contribution to the university sponsorship programs, but the portion that is supposed to be remitted by HELB is still pending. Therefore, subjectifying these learners to humiliations and waste of time in the universities, and some of them cannot be able to qualify to sit for exams. I am seated here this morning as a mother, flagging the issue of BCG and polio vaccines in our public hospital as an emergency. We cannot continue to discuss matters, politics, when we cannot be able to even cater for our newborns. Health right is a right enshrined in the Kenyan Constitution. Infants are human beings like any other person catered in the Constitution, and providing their polio and BCG vaccination is part of health rights. As we wait for the President to address us during Madaraka Day happening soon, it is my sincere hope that he's going to address himself to reasons why we have not this vaccination, and not only promise but deliver before Madaraka Day. It is also my hope and expectation that the President is going to speak to the issue of HELB. Yesterday, he attempted to give an apology, a cross-cutting apology, including to the young people. But cross-cutting apology without deliverables is empty rhetoric. You cannot ask for forgiveness, yet you are still continuing to commission the same errors that you commissioned, that you seek apology for. You cannot ask the young people to forgive you for errors of commission and of mission, but you still continue to do the same and render the same. We still are requesting you, as you seek for forgiveness, please tell us, where are our missing young people who disappeared between June 25th last year to February this year, 2025? We still have over 67 young people unaccounted for. So asking for apology, yet you are not able to help us close those cases of disappeared, unaccounted for young people is open rhetoric. As we prepare for Madaraka Day, we expect you to tell us what processes and interventions have you put in place as a president and the CEO of this country, so that you can also assist us to close on those open cases that we still are struggling to close. Thank you very much, and have a good day. Oh, okay. Is there anybody with a question for Kiswahili English version?
Yeah, Kiswahili English Manisha ask.
Yeah.
You said the president
the door is really disturbing.
Yeah, actually we had an interview with the Kenyan youths, especially those from the universities that attended their breakfast. They don't feel that this came from the president because, as you've mentioned, the youths went missing and families are mourning. They're asking questions. Do you think the president means what exactly he says?
Well, I may not be able to read his heart, of course. I don't know what motivated him to say what he said. But to me, that apology was very cross-cutting. It was a generalized apology. I mean, he apologized to Uganda. He didn't say why. He apologized to Tanzania. He didn't emphasize. He apologized to the young people. To me, I think it was a cross-cutting apology. And like I said, I actually posted even on my socials, and I said, I think that it will be difficult for us to accept such kind of an apology when whatever he was apologizing for or whatever created the rifts between him and the young people has not been sorted out. Young people were protesting around the issues of banding, discrimination in the access to education. Has he sorted it out? Even as we continue banding our students and discriminating some against the other or against the system, we still have issues of even those that have already qualified for HELB sponsorship are still getting punished. I mean, for heaven's sake, It's not my duty as a student to go to HELB and follow up my HELB sponsorship, yet I have a confirmation on the portal that I am sponsored by HELB. So the universities are tossing the students. The students, they are getting tossed between university and HELB. So the president and the Ministry of Education have continuously ignored this problem, to the extent that now the students are going to the examination rooms and they are being jettisoned out of the examination rooms because they have not, the university has not received the portion that is supposed to be sent by HELB. So if such issues cannot be sorted out, including the missing ones, who we know they missed from the streets. They were picked from universities, they were picked from the street, from their houses, from their neighborhoods, from the hoods, but they have not been accounted for. Then how do you come in here and tell us you want to be forgiven? For what? You've not sorted out the problem. So I think, to me, his apology is a bit general, and I am not the one. He didn't ask me for apology. He asked for the young people's apology. So for me, I'm just analyzing, and I'm saying, as a mother, I feel for the mothers who really are still struggling and crying for justice, I think that apology to me is an open rhetoric. Yeah.
He has 20 advisors, and you mentioned.
Yeah.
What happens to his advisors? Because, you know, quite a number of Kenyans have been saying that he advises his advisors on how they should advise him. Imagine having a number of at least 20 advisors, but look at how things are happening in the country. In whose hands are we safe?
Clearly, the president, our president of the day, requires actually even more than 1,000 advisors based on how he manages this country. Yeah, he has proven to us that he requires even 1,000 advisors, but unfortunately, they are all advising him into mess, not out of the mess, but into the mess. That's my take. But clearly, the way he is right now, he just doesn't even require 20, he requires 1,000. Because everything in this country is a mess. Education is a mess, health is a mess, agriculture is a mess. Right now, as we speak, we are staring at a serious problem in tea. The president's relationship with with Sudan, he messed up. I'm sure you know his utterances, his actions. He messed up. And our tea is locked up in Mombasa's warehouse and Khartoum's Port Sudan's warehouses. We have over 200 containers of unsold tea in warehouses, stuck up. That was tea that was already blended, already branded, and packed for the Sudan market. Mind you, Sudan is #1 off-taker of the best quality tea from Kenya. Who is advising him? That is why he actually needs 1,000 of them, because the 20 that are advising him are already messing him up. So he cannot now be able to tell us who is going to bail out the traders, the owners of the tea that is stuck up, who is going to bail out that 220-foot containers tea belongs to the farmers. So at some point, the losses in Mombasa, the losses in Port Sudan are going to be affecting the bonuses of our farmers. Who is advising him? Who is that who is advising president on matters relationship with Sudan? Who told him to say whatever he said and repeated it in these media stations, that even after Sudan's claims that they are not taking our tea, they are taking our tea anyway? That's what he said. And immediately after that, Sudan released a communication and they said even that tea that is already in the port must be returned back to Kenya. So I think the president is in a total mess. He must accept he is unable to govern this country. He must accept he has failed Kenyans. He must accept that he has mutilated the economy of this country. Time is up for President Ruto to actually face Kenyans and confess that he is able to run and govern this country. Playing politics on top of the roof of the car does not help him. Taking flights to other countries to look for solutions does not work. It's not working for him. Now he's making another finance bill, 2025. Looking at that finance bill, he's sinking us into a bigger hole of borrowings. He has not raised sufficient money through 2023-2024 finance bill. He promised that he's going to overtax us for 2 years and then he will recover. We are now going to the 3rd year. The finance bill he has presented is even worse than the 2023-2024. He's now targeting the hustler, the bottom of the pyramid. He's targeting those people. And I thank IMF for the first time. I'll thank IMF. They even told him yesterday, stop it. Stop taxing the low-income earners. Stop overtaxing the informal sector. This economy is going to collapse. They have already told him to stop, because that is the proposal he has brought through his executive to Parliament. His proposal is to actually make sure that the low-income earners start paying what they were not paying. The relief that he had given to the low-income earners in factories, in the informal sector, he has removed this through the proposal. So the president and his advisors have failed. Those 20 advisors are just looting our money, eating our money, and doing nothing. And it's time to call a spade a spade. So telling us to forgive him, and he has not been able to recover the economic status of this country, is rhetoric. Asking for forgiveness, and he has not produced the missing young Gen Zs that disappeared from the street from June 25th last year to this year, February, is a rhetoric. Telling us to forgive him when he's already messed up the relationship between Kenya and Sudan is rhetoric. And we require more, and we demand more from him. And even abandoning our mothers and our infants. You can imagine, in the history of this country, we've never had a president who cannot be able to provide polio vaccine. We've never had. We have had bad presidents, Mois of this world, Kibakis of this world, Uhurus of this world. But we've never had a president who cannot be able to provide basic vaccination to our infants. This is the worst inhuman treatment you can ever give to, innocent children who are being born. And I can't imagine in the next 3-4 years what will happen in the country in terms of our health reporting if we cannot be able to facilitate BCG and polio vaccinations to our newborns.
Maybe he needs some more time to work on this.
And how many babies are you going to have messed up? How many people are going to be disabled in this country? Because lack of polio vaccine automatically calls for disability. If right now the many disabled persons in this country, we are not able to fund them, we are not able to feed them, we are not able to provide education for the ones that we already have, yet an efficiency way of vaccination. What about now during the Kenya Kwanza regime, where this month we have BCG and polio, the other month we don't have? In 10 years, how many people are going to be disabled in this country out of the mess that we are witnessing today? It's very unfortunate, and that is why I normally don't do these presses, but today I say it because of the mothers, because of the infants, and I am a mother, a woman leader, the outgoing Kewapa chair. I must speak. Hii bunge imekataa kuongea. Wabunge wamekataa kuongea. Wamenyamaza. Women leaders and women MPs, I'm not here to bash them, but it's unfortunate that even when we have this kind of challenges and loopholes, women leaders cannot wake up and talk and speak for the innocent women who are giving birth in our public hospitals and they cannot get polio and BCG vaccinations. It is very unfortunate. Tumenyamaza wakati hakuna diapers, ni sawa. Tumenyamaza wakati hakuna sanitary towels, ni sawa. Lakini hatuwezi nyamaza wakati maisha ya watoto wetu inadhulumiwa na haki zao zinadhulumiwa. Those are innocent children who know nothing. Why are we subjecting them to this kind of violation? That's my take. Thank you. Please, now, I request you to concentrate on the BCG polio issue. I have said many things, but please. Yeah, I'm being distracted by the door. Senior, ako hapa. All right, deha harushi ni rwa umuthi ndeta mutumia mutongoria mujumbe wa Githunguri no nĩ njĩraga andũ thurĩtwo Githunguri no maũndũ marĩa njaragĩrĩria matiahutagia andũ a Githunguri marĩ oike. Ũhoro wa thirikari gũkorwo nĩ maremetwo nĩ kũhe aciari arĩa maragĩa twana na twana tũu tũkaga kũheo njanjo iria twagĩrĩirwo nĩ kũheo, njanjo ya polio na njanjo ya BCG, nĩ ũhoro ũtũmĩte ngĩe na kĩeha ndĩ ta mũciari, na ndoiga ũmũthĩ ndigũkira tondũ gũkũ tũrĩ mbunge andũ nĩ maremirwo nĩ kwaria nĩ ũndũ wa kũguoyohi na siasa, magetigĩra siasa iria igũka thutha mũndũ aria. No niĩ ndoigire nĩ ngũtua mĩkwa, nĩ ndĩrĩaragia na no ngwaria nĩ tondũ ũrĩa ndĩreka ndaya gũkorwo ti niĩ ndĩreguna, no nĩ ngũguna ciana nyingĩ iria hihi ingĩkorwo cirĩ hatĩka-inĩ. Ndagĩka ĩno tũraria na inyuĩ nĩ nyamũkĩrĩte riboti atĩ kũrĩ na thibitarĩ nyingĩ mũno thĩinĩ wa bũrũri ũyũ witũ itarĩ ndawa. Mandagĩtarĩ makĩria ma 8,500 nĩ magomete nĩ ũndũ wa thogothogo ya mĩcara yao na marĩhi mao na mĩrutĩre yao ya wĩra thĩinĩ wa counties. No nĩ ngũcaya mũno tondũ rĩrĩa thirikari nene yona kwĩna thĩna thĩinĩ wa sekta ya ũrigitani, handũ ha gwĩtĩkĩra atĩ mũrigo wa ũrigitani ũkoretwo wĩ wao, ũhoro wĩgiĩ mĩhang'o ya kwandĩka marigĩtarĩ marĩa yahũrire thĩna ũcio maraikĩria counties. Ta rĩu gwitũ Kiambu nĩ njũĩ nĩ muonete kũrĩ na case tũrarĩ nayo kana kaũndũ tũrarĩ nako kararĩ na kĩeha mũno ka mwana ũrakuire moko-inĩ ma mũciari metereire kuona ndagĩtarĩ, metereire ndagĩtarĩ mũthenya mũgima kũrĩa igagania thibitarĩ Gatũndũ North. Na toigagania thibitarĩ nĩ nyingĩ nginya Githunguri gũtarĩ ndawa, ũthiaga gũkakora nginya Panadol gũtirĩ. Worio kerwo thirikari nene ndĩrĩ yatũma mbeca kũrĩ counties. Woria thirikari nene makoiga twatũmire mbia, governors makĩanjia gũtwara mbeca kũndũ kũngĩ. Rĩu rĩ Kĩng'ũrũ mwene nao ena kĩng'etho nĩ ũhoro ũtũmĩte andũ a Kenya maigue ruo tondũ Kĩng'ũrũ nĩ thirikari nene nake Kĩng'etho nĩ governor, gatagatĩ-inĩ rĩ nĩ ithuĩ tũraigua ruo. Rĩu tondũ mwana nĩ arakuire igagania rĩ na nĩ mwana ũrareretwo nĩ mũciari na agaciarwo nĩ mũciari rĩ, nũ ũkarĩha family ĩyo hathara na ruo? Nĩ governor kana nĩ national government? Ũcio nĩ ũmwe wa ũrĩa tũrahotire kuona arekondetwo ka video. Nĩ aingĩ makuaga ambulance-inĩ wagĩte oxygen, nĩ aingĩ makuĩrĩire corridor makĩgeria kũheo ciana. Tũrenda kuga atĩrĩrĩ, enough is enough. Gũtingĩtuĩka atĩ ithuĩ nĩ tũrarĩha igoti na niĩ nĩ ndĩrarĩha igoti na we nĩ ũrarĩha igoti, no tũtingĩhota kuona mbeca cia kũgũra njanjo ya polio na ya BCG harĩ mwana ũraciarwo. Na niĩ ndĩ ta mũtumia mũthure ndoka haha kũrũgama ndĩ wike tondũ na ingĩgeria kũmobilize kũrĩa bunge atumia moke twarie matingĩtĩkĩra, makiraga ki. Tauro cia atumia cio theru ciaga kũgũrwo nĩ thirikari matingĩtĩkĩra kwaria tondũ nĩ mendeirio guoya. Ngenda kuga atĩrĩrĩ, ira tũronire president akĩhoya kũrĩa mararĩ mahoya na ndinathiĩ mahoya macio tondũ ndĩronire ta ndathiĩ kũu ngũthi kũnyũrũria Ngai. Gũthiĩ kuga nĩ twahera kĩ? Na ciana iria tũragire gũkũ Nairobi tũtirĩ tũiga twatwarire mĩĩrĩ yao kũ? Twahera kĩ angĩkorwo no tũraherithia aciari aitũ maraheo ciana na matingĩona njanjo ya polio na BCG? Twahera kĩ angĩkorwo macani maitũ marĩ o kũrĩa Mambatha makomete magĩte mũgũri tondũ president nĩ athoririe bũrũri ũrĩa ũragũraga macani wa Sudan? Twahera kĩ angĩkorwo no tũrathoma magathĩti atĩ bilioni 100 nĩ iraiywo kũrĩa Mambatha poti? Twahera kĩ angĩkorwo tũrerwo bilioni 19 nĩ ciatahirio account ya consolidated fund mweri wa February mwaka ũyũ? Twahera kĩ angĩkorwo no tũraherithia andũ aitũ tũkĩmarengaga igoti na tũtirahota kũhe andũ nginya fees ya university? Rĩu niĩ ndagĩũka hakuga atĩrĩrĩ, ndĩ ta mũciari ndaigua ruo ndoiga ndigũkira rĩngĩ. President William Ruto na thirikari ya Kenya Kwanza na ministers yake okorwo nĩ maremetwo nĩ gũtũhe nginya njanjo ya polio, nĩ moe moko na igũrũ moiga nĩ maremwo nĩ wĩra. No tũtigũtũra twĩranaga tuoherei tũhei kahinda. Rĩu nĩ mĩaka 2.5 kuma rĩrĩa William mwatũrie tũmũhe kahinda. Agĩtũhoya kahinda kau rĩ, nĩ aramenya kwĩna mwana ũkuonja nĩ kwaga njanjo ya polio. Agĩtũhoya kahinda kau aratũhoya agĩtwĩraga ndekerai rĩ, nĩ aramenya kwĩ mwana ũkũgĩa mũrimũ wathe atũre na wathe nĩ ũndũ wa kwaga njanjo icio cia polio na BCG. No tũgĩkuoherera rĩu rĩ, mwana ũcio nja agakuoherera kũ? Nĩkĩo ndĩ haha Samoei Ruto thirikari yaku ukirai na muririkane no mutonge umuthi na indo iria muratahia mwage kuhe ciana njanjo no ni kuri Ngai urihanagiria na gutire wathi uthiaga iguru. President Ruto ni umwe wari amena atari aingi muno thiini wa history ya bururi uyu. Ona riria wa Kenyatta uria turatindaga tukiugaga Mariza aende ya metagwo advisor aingi ta William no Uhuru ndari na mathina ta maria oete andu maingatirwo ni andu ni kuiya indo cia muingi oete andu aria njega na Githunguri rejects ni wacokaniriria kama tu advisor ungitarwo ni mundu watigire standard 2 ri ni githomo kirikwa ngiguthomithio tari koguo andu acio othe ekirite hau atari acio metagwo advisor marahuthira makiria ma bilioni 1 misara o mwaka na ni kumutera maramutera mbeca na mahinda na maramu advice kana maramutara uria guthikana matiramutara uria egutofora maramutara thinikane na gutiri wira mararuta magiko makiruta wira uri kwangiko matiramwira munene ni kuru gutiri polio njanjo ya polio munene ni kuru macani maria marendagirio mukuria Sudan ni magire thoko na ni tugucina arimi na bonathi ciao ni wira uri mararuta ko acio ti advisors acio ni political rejects mahetwo wira mahorerio matigakie miaki ya siasa kwao mundu one kanyamu arinukagia muico wa mweri siasa cikuhiriria 27 macoke magacaria ite o iria magire kuheo ni wananchi. Kihonia ni President William Ruto etikire ati ni kuri kindu gitagwo separation of power na ni kuri kindu gitagwo devolution. Wira wa magavana ni atigane naguo ni aneane wira wa magavana kwi magavana na mbia cia magavana arekererie ciothe. Riu ithu tutigirwo magavana tumanure no ri urathi kuhura gavana gakwira we utanahura ririkane nditumirwo mbeca ciakwa we utanahura ririkane ndanengerirwo health no andu aya metagwo health workers matigirwo national government utanahura uririkane community health workers ya maheirwo wira William Muigire ndirihaga nuthu na kiaririhaga nuthu niki kiratuma ende gukorwo guoko gwake kumwe kwi national government na guoko kungi gwake kwi county government. William ni amenya atiriu niwe orehete thogothogo eno yothe ni undu wa gukorwo arenda kuhimbiria kila kitu. Wira wa national government ni ukorwo wa national government. Wira wa counties ni neo counties na counties maheo bia ciao. For example, niki gigutuma William Ruto akorwo ni athiaga gwaka thoko na akoiga thoko eno ifanditwo ni national government na nie nawe ni tuwi wira wa thoko ni wa governor aregaga guruekaga okorwo akienda guthie kuonekana ni aruta wira ri ndeterere governor arikie thoko mathi makahingure thoko gukorwo ndikuo kurathogothania counties agatuma national assembly members marwe na magavana tari gwitu Kiambu ri kwina haro tahana haro ya mathoko tondu riri MP wakuna ni erirwo ni William Thio wake thoko na mbeca igitumwo kuma national government nake wa matangi witu ni arenda gwaka thoko tondu niwe wi na thoko na niwe governor gukwaga kurwo niki riu ni uratuhurithania na thogothogo eno murona ginya yakaga BCG na polio niwe tondu ndarekaga ginya ministers marute wira ategwikira guoko gwake ho ekagira minister akamuhe federal na ritwa no rungwe na PS esi no huragirwo thimu akerwo ikona nona utire hindi wira ukaruteka. And it is all about governance and leadership. Ungikorwo wewe munene wa wabici na ndurekaga mutumia uria uri wabici aruge cai uturaga mukorogaga ukimwiraga ngerera irio ngerera macani cai ukarugwo ri no he. Thank you very much. Please, Damodha, now nauliza kwa heshima sana. The reason why I've done this presser is because I wanted to talk about polio and BCG lack in public hospitals. That's my presser. The rest is fodder for the day. Cynthia, I'm not trying to say the rest is not important, but my concern is polio and BCG lack. Sawa?
Are in charge. More Radio 88.2 FM. We are in charge. More Radio 88.2 FM.